Hi, I'm Alec Martinez with Home and Rehab, and today we're going to talk about a condition known as frozen shoulder or adhesive capsulitis. Now, we will sometimes refer to any shoulder that loses range of motion or the ability to reach in directions as a frozen shoulder. However, adhesive capsulitis is a very specific condition. While if I injure my shoulder in the rotator cuff, the labrum, or have something called impingement syndrome, I will notice that I'm not able to reach in all directions to the same degree. Adhesive capsulitis seems to be more idiopathic, which means we're not entirely sure what caused it initially. However, over a period of a couple of months, patients with this condition will begin to lose range of motion over time, even if their doctors and physical therapists have been giving them appropriate exercises to try and maintain that range of motion. The important thing to know if you have been diagnosed with this condition is that is actually relatively normal. We see patients over that period of months lose range of motion and begin to stiffen down, but then go through what we know as a thawing phase, which is when, out of nowhere, they'll begin to regain the ability to move through that range of motion. What's important to know at this stage is that as soon as you start regaining that ability to move, you want to start doing exercises again that allow you to stretch yourself back out in all the different ranges that you have been trying to maintain in the first place. Usually once you reach this thawing phase, you'll begin to have a little bit less pain and be able to start doing exercises that stretch you back to your normal range and allow you to build up the strength of the muscles that may have atrophied while you weren't able to use them. In other cases, when we diagnose frozen shoulder, what we mean to say is that another injury has caused you to lose this range of motion. And in that case, what you'll begin doing right away is the same exercises that allow you to regain that range of motion, but you should notice a lot more success in those early stages. Your physical therapist will be measuring you every week to make sure that you are regaining that range appropriately, and if you're not, you should notice that you receive an appropriate referral to a physician to diagnose adhesive capsulitis. Regardless of what's going on, it's important to know exactly which condition you have, and we always recommend that instead of self-diagnosing, in conditions like this, you visit your medical professionals and decide what course of action is right for you, whether it is to wait and see, start physical therapy, or wait for other medical procedures that may be beneficial to helping you progress a little bit further. Again, if you have any questions, always feel free to ask us and we'll try and get back to you as soon as we can. Have a great day.